Dr. Richard Krasuski from Duke University, and today we're going to talk about the risks or side effects of combination therapy in pulmonary hypertension. So first of all, the use of combination agents, if you think about it, obviously brings forth the problems with one agent and combines it with the problems of the other agent. So when we talk about endothelin receptor antagonists, bosentan especially, and macitentan less, can have a significant risk for transaminitis. Bosentan and sildenafil is especially problematic in this regard. In fact, it's a warning that you want to be careful using those two in combination. Also, we have data that probably combining those two agents may lessen the benefit of either agent. So you would think it would be an additive effect, but it is not. Ambrisentan appears to have little to no hepatotoxicity. And then the combination of an ERA and PDE5, there are some nuisances. In particular, nasal congestion appears worse with ambrisentan, in particular when used in combination with the PDE5. Headache and fluid retention are common, but usually these are transient with combination therapy. And in ambition, interestingly enough, fluid retention did not appear to be problematic. Riociguat, hemoptysis can occur, although it's fairly rare, but it should obviously be a concern if it's observed in the riociguat treated patient. It's important to recognize that this drug is utilized in patients with thromboembolic disease, so it's important to separate out a idiosyncratic reaction of the drug to somebody who's having pulmonary embolism and more complications. Hypotension appears more common than with other PAH therapy. You should certainly and importantly never use riociguat together with a PDE5 inhibitor. In general, the hypotension is usually not problematic, and if you do have problems, you typically will slow down escalation of the dose. It's not clearly amplified by background therapy in the patent study. Prostacyclins and analogs are well known to have a number of side effects, although there are very impressive data demonstrating benefit to this group. It's almost universal that patients will develop problems related to prostaglandins, such as headaches, nausea, flushing, jaw pain, diarrhea, leg and back pain. Adverse events generally are amplified in intensity for those patients that are already on background therapy. And it's important to recommend to discuss the fact that these are delivered in different ways, and these delivery systems themselves have problems associated with them. So first, if you're getting an IV prostanoid, you're at increased risk with an indwelling line for problems such as sepsis, thrombosis, and embolism related to the line, and also endocarditis. If it's administered subcutaneously, pain is a major problem for these patients. As a matter of fact, the data suggests it's over 85% of patients that have significant pain when the drug is administered subcutaneously. And finally, in the inhaled form, it's very, very common that patients will have coughing, particularly during administration of the agent. So today we discussed in summary the risks and the side effects that are associated with combination therapy. Again, when you're combining agents of different classes, you often amplify some of those side effects. However, it's important that you have to weigh the benefits and the risks with each agent in each of the patients that you take care of before prescribing them and leaving the patient on those medications. And I thank you for your attention.